We're going to take care of you this morning. We're going to be debunking the myths of cholesterol, and we also have French fry heaven. Settle in. Your morning's off to a great start. It's time to begin Arizona Daily Mix. Well, we don't want you to eat too many fries because we want to have your cholesterol be in check. It is National Cholesterol Education Month in September, which is like, what, 2 days away? So we're going to get you up to speed, and we're going to debunk some of the myths, because a lot of people think, you know, well, I feel good, it's not that high. But you know what? You could still have a heart attack or even a stroke based on your cholesterol. So we'll get you in the know with that. Now it's time to talk your health. We want to take care of your cholesterol. September is National Cholesterol Education Month. It's just around the corner. We're going to get some insight from Dr. Anne-Marie Feyrer-Melk. She is a cardiologist at the Optimal Heart Attack and Stroke Prevention Center. That is a big title.
Yes.
You do a lot
to
help people get on track with their cholesterol and understand that this is very important. So let's talk about education for the month of September. What type of things are going to be encompassed in that month covering cholesterol and more things with our health?
Get it checked. The number one thing is to dig your head out of the sand and go ahead and get your cholesterol or your blood fats checked. You can do this through your doctor, or you can pay cash at a local laboratory to have it done.
Wow. And how often should someone get their cholesterol checked?
The American Pediatrics Association recommends that you start at age 2.
At age 2?
Yes, so we should be starting young with our children. And then for adults, if you have it checked annually and it's normal, that's one thing. But if you've got an abnormality with your cholesterol profile, then you need to have it checked quarterly until you get it under control.
Because we do not want to have someone having a heart attack or even stroke. And those are the common things if your cholesterol is too high.
Right. So heart attacks and strokes are absolutely preventable.
Okay.
And so we oftentimes think, oh, someone dropped dead of a heart attack and they were the picture of health. You know, why did this happen? You know, it's not a big mystery. Our bodies are not so mysterious that we can't figure this out. Cholesterol is one of the pieces of the puzzle that we need to look at. But cholesterol is not the main culprit. There's many other things that we need to look at in addition to cholesterol. I mean, cholesterol in and of itself is vital. We need it for our hormones, we need it for our brain tissue, we need it for our nerve sheaths and so on. And so it's really been vilified lately. What we have to do is look at cholesterol in the setting of other issues within the patient's body.
And I know you brought some props here, and these are the things that you demonstrate to give people a visual about their heart and in just their arteries and stuff, correct?
I mean, what cholesterol will do inside the arteries is it can become yellow plaque. And that's the main reason that cholesterol is dangerous, is that it contributes to this yellow plaque growth. And once that plaque starts to heat up or become inflamed, that plaque can rupture open, and that's what causes heart attacks and the vast majority of strokes.
Oh, now, so when someone sees something like this, do they take it seriously to heart, or you happen to repeat yourself over and over again to some of the same patients?
Well, I think part of the problem is that we can control our cholesterol or our blood fats with lifestyle modifications in wonderful ways. But that's hard for most people, so sometimes you have to reach for an evidence-based supplement to help you with your blood fat, or sometimes you need to go on a prescription medication. So it's a real evolving process, and patients becoming educated and owning their own health.
And that's key. You have to be educated. Well, let's talk about debunking some of the myths, because a lot of people think that, you know, if my doctor hasn't said anything or mentioned anything about my cholesterol, I must be okay, but that's not true.
I know. The biggest problem is that fully 50% of patients who have heart attacks have completely normal cholesterol levels.
Really?
So it's not all about just the cholesterol. There's many other factors involved, but cholesterol is definitely a player in that process.
What about someone who takes medication for cholesterol? Is that an easy out to say then you're going to be fine if you're already on medication?
No, because again, you know, if we just fix cholesterol, we're not fixing all the other things. They have to be measured along the way, particularly inflammatory, what we call biomarkers. We now have 13 different biomarkers available on the market that we can do to check someone's arterial health and see what is their cholesterol doing. Is it a silent bystander, or is it going to be a player in a major event upcoming?
All right, we've got it again. It's National Cholesterol Education Month. We want you to get yourself checked out. If you need to go, or if you're even thinking about something to do today, maybe go get your cholesterol checked so you don't have a heart attack or stroke. Thank you for being here, Dr. Anne-Marie.